Welcome to today's Explainer. I am absolutely thrilled to guide you through this one because we are diving deep into a seriously fascinating and, honestly, highly misunderstood medical topic. We're decoding cerebral palsy, and specifically, we're uncovering the surprising reality behind its risk factors. If you think you already know exactly how and why CP develops, well, get ready. The data we're looking at today is going to completely flip the script on what most of us thought we knew. Let's dive right in.
So, right out of the gate, I've got to ask you, what actually causes cerebral palsy? When you hear those words, what instantly pops into your head? For decades, the prevailing narrative, even among a lot of medical professionals, was that CP mostly happens because of complications inside the delivery room. A lack of oxygen at birth, right? Well, we're setting up a major myth-busting mystery today because the actual medical data tells a totally different story.
Less than 10%. Honestly, that number blew my mind. Less than 10% of cerebral palsy cases are actually caused by severe birth asphyxia. So that classic myth that CP is mostly due to a lack of oxygen during a tough delivery, it's literally just that, a myth. It only accounts for a tiny, tiny fraction of cases, which leaves us with a pretty massive question. If the delivery room isn't the main culprit, where on earth should we be looking?
That brings us perfectly to Section 1, the prematurity paradox.
This is where the stats get kinda wild, and it's arguably the most mind-bending risk factor for CP. Take a look at this crazy contrast. On one hand, we've got the highest risk rate. Premature infants, especially the ones born before 28 weeks, have an absolutely massive risk of developing CP. We're talking up to 30 per 1,000 live births. But look at the other side. Because the sheer volume of full-term births is just so astronomically high compared to preemies, the raw number, the highest total count of kids actually living with CP, comes from the full-term group.
There's actually a medical pearl of wisdom from our source text that hits the nail right on the head, and it perfectly captures this paradox. It says, although prematurity is a major risk factor for CP, most children with CP were not premature infants. I really want to lock that into your memory because it's a super counterintuitive truth, but it totally shifts our understanding of where CP actually originates in the broader population.
Moving right along to Section 2, maternal and prenatal risks.
Okay, so if it's not just the preemies and it's definitely not just the delivery room, we've got to rewind the clock. The true risks actually begin long before the baby's even born. Think of it like a timeline. We start before birth, which is all about maternal health. Then we hit during delivery, which, as we saw, is a really small slice of the pie. And finally, after birth, during early infancy. Let's zoom in on that critical, very first stage, before birth. The big takeaway here is that we're dealing with hidden prenatal risks. We are talking about specific maternal health factors that can trigger a fetal brain injury months before labor even crosses anyone's mind. This includes things like maternal thyroid disease, bleeding disorders, also known as coagulopathy, and a really notable one called chorioamnionitis, which is a severe maternal infection. These infectious and inflammatory processes, especially when they're combined with a low birth weight, are these massive, silent drivers behind the brain lesions that ultimately result in CP. And as you'll see here, this is the physical result of those hidden risks. This is a really striking MRI showing a condition called periventricular leukomalacia, or PVL. Do you see that white matter damage right near the lateral ventricles? That's the most common neuroimaging abnormality we see in CP, especially in preemies. It literally bridges the gap between an abstract prenatal infection and a tangible structural brain injury. And just for context, this specific damage often results in spastic diaparesis, which means severe muscle stiffness that primarily affects the legs.
Which leads us to Section 3, the birth asphyxia myth.
Let's finally put that delivery room myth to rest for good, because the macro-level data reveals this fascinating technological irony. In modern medicine, we have these incredible, highly advanced fetal monitoring capabilities, and because of them, we've seen a huge increase in C-section deliveries that were intended specifically to prevent birth asphyxia. But guess what? CP rates haven't dropped at all. They've stayed completely steady or even increased slightly. This pretty much proves that what might look like delivery room asphyxia on the surface is very often just the fallout of an intrauterine infection or a coagulation disorder that happened way before labor ever started.
And finally, Section 4, risks after birth.
Because as it turns out, while the developing fetal brain is super vulnerable, the risks don't completely vanish the second a baby is born. There's actually a really interesting geographic split when we look at postnatal dangers. In developed nations, post-birth CP is frequently tied to early infancy trauma, but in developing nations, postnatal infections are the main driver. Also, we can't forget kernicterus, which is when severe untreated jaundice reaches toxic levels and causes bilirubin-induced brain damage. Better jaundice treatments have thankfully made this way less common today, but for sure, it remains a critical risk factor.
So what does this all mean? What's the ultimate takeaway from this explainer? Well, the causes of CP are incredibly complex. They are heavily weighted toward prenatal and prematurity factors, and it's rarely just a simple delivery room error. Which leaves us with one final provocative thought to chew on. As we continue to evolve our prenatal care and deepen our understanding of maternal health, how are modern medical advancements going to shift these risk factors in the future? Could we eventually prevent those prenatal infections that cause this white matter damage altogether? Thank you so much for joining me today. Keep questioning and keep learning.